Hello everyone, how are we doing? This is Dr. Aderemi for Mom Health Parenting YouTube channel, and today I'm going to be talking about something in our babies, in our children. I'm going to be talking about ear infections. I'll be talking about ear infections in babies and in children. This is because a lot of women have come to us with concerns about throat infections, about ear infections. So I'm going to discuss ear infections today on this channel, and it's important for you, if you think your child has any sort of infection, ear, nose or throat, for you to listen to this video and for you to decide whether your child needs to see a physician or needs to see a specialist. Ear infections generally are in two classes. I won't bore us with the details, but ear infections could occur inside the ear and ear infections could occur outside the ear in simple terms. In children, usually they have a certain tube that runs from the throat, links the throat to the ears, and in children it's short. As we get older, it gets longer, and so ear infections are relatively common in babies and are relatively common in children for this reason. When a child has throat infection, you notice your child is having a running nose, your child is coughing, your child is sneezing, your child is complaining of throat pain, or you check your child's mouth, you see what's at the back of the child's throat, the tonsils look a bit inflamed, look a bit enlarged, and then after a few days you notice your child comes up and starts telling you, oh, I've seen a baby who says, oh, I have an insect in my ear. What she's trying to describe, she's about two and a half, what she's trying to describe is she has some pain and some pressure in her ear. She keeps tugging at her ear. This is a kind of ear infection. The child feels pain, the child feels pressure. This is because the tube is now congested. The tube has accumulated fluid, so there's a feeling of pain, there's a feeling of pressure in the ear. When this happens, the child is uncomfortable, the child can be feverish, the child can be throwing up whatever the child eats, the child could have nausea, so the child could have nausea, the child could be vomiting, the child could be running a temperature, the child could be complaining of headache, eye ache, the whole face. This is because whatever affects the ear could go ahead and affect the whole face. Child could be running, have a running nose, running a temperature. So it's very important. This pain and this pressure that has built up in the child's ear will make the child uncomfortable. Child might have loss of appetite, can be refusing food, child can get dehydrated. So it's important for you to take note of this thing and to act immediately and appropriately. So what happens if there's buildup of pain and pressure from this tube I told you? Ear infections are caused from microorganisms, bacterial, viruses from the throat, from some passages in our face, the sinuses. When they get to the baby's ear, cause this buildup of pain, cause this buildup of pressure. Another thing is there's something we call the eardrum. If the pain and pressure keeps building up, what happens is that you have a burst in the eardrum, and when this happens, you now have yellowish discharge, bloody discharge coming out from the child's ear. It's very important at this point not to put anything into the child's ear. Don't try and clean anything. Just take the child to see a physician, take the child to see a doctor, so that appropriate antibiotics, appropriate treatment is given to this child. At this point, it's also important not to put the child in any form of water, not to put the child in a pool. This is because you don't want more fluid. The eardrum is open, you don't want more fluid to get into the ears. Another thing is you could have the outer ears being affected, and you could have an infection of the outer ear in children. Usually it could be from poor hygienic practices, from dirty water, from any form of infection. So at this point, it's important when the child's complaining of pain to give the child pain relief. Yes, child is running a fever, you could give the child an antipyretic, you give the child something like paracetamol. When this happens, you try and calm the child down, try and ensure the child stays hydrated, the child is drinking whatever the child wants to drink, fluid, juice, any form of juice. The child is taking something so that the child is not dehydrated. You keep the child warm, pain relief, ensure the child isn't running a temperature, and if it persists and it doesn't resolve, you're supposed to take the child to see a doctor. You're supposed to treat the child for the cold, for the infection. All this, do not prescribe antibiotic drops or ear drops or nasal drops by yourself. You take the child to see a physician, and if the infection becomes recurrent, if we see that this infection, we have this child is coming back into the clinic with recurrent ear, recurrent throat infections, what we do at this point is to contact a specialist, a ear, nose and throat specialist. This is so that the child can be properly evaluated and can be properly managed. Thank you very much.
Thank you very much. Please don't forget to subscribe, don't forget to like, and don't forget to share this video. Also, hit the notification button to get more videos like this. You can also visit our website at www.momhealth.com.ng for all maternal and baby products. Guess what? We have a 10% discount for you for all purchases made on that website. Another good news we have for you is you could also visit Google Play Store and download the Mom Health mobile app to explore all our amazing features. Thank you very much.